This program is brought to you by the Forbes-featured Freedom Hub Health Plan, the alternative to overpriced and restrictive insurance. The Freedom Hub Health Plan is exactly what you need. By Frequency Medicine Associates, supporting health professionals and laypersons with safe and effective advanced telemedicine-like technology that can scan and help rebalance the root causes of stress and illness. By the Planet Lockdown film, which can be seen on the Freedom Hub's Rumble channel along with many great speakers. And by The Pavilion, a 21st century community hub that brings together many of the disruptive innovations featured by the Freedom Hub, including direct pay healthcare, farm-to-table dining, TED-like Freedom Hub talks, and more. Visit your-mp.com/pavilion solution for details.
Welcome, folks, to Freedom Hub's weekly health webinar. Our other one on Thursdays is broader liberty, entrepreneurship, regulatory capture. We always push the envelope, and we do so in healthcare as well. Both co-host Jim and I, and marketer Joe, are engaged in disruption and innovation of the healthcare field. You know, if you were to ask us, what is our vision? Well, it's not the present top-heavy cartel. It's, as you've seen in the theme of all these leaders over the past 40 years of doing this weekly, it's folks who want to give patients a broader, more personal experience, and to free healers to do their job. Hippocratic oath, expansive idea on what healthcare is. And primary care has been an interesting kind of series of different guests. We've had a lot of DPCs on here. You pay them a monthly fee, they give you time. And what we've liked about that is these mostly allopath doctors become integrated by necessity. Because if you follow the stats, allopathy or mainstream medicine has failed to stop the real epidemic in this country, which is chronic disease, affecting now half the country. These pills are helpless to stop that endless epidemic: cancer, heart disease, diabetes, autoimmunity. It's a huge world, chronic disease. And then all these studies point to the fallibility of all these FDA-approved medicines that get recalled. Cambridge just did a study saying high-quality evidence backs only 6% of what is prescribed. So there have been a lot of people trying to figure out, how can we upgrade the entry point of healthcare in primary care? There already are integrated doctors, but they're disjointed, not organized. Mark Aubry is a serial entrepreneur in the healthcare field. He's got a really good background for coaching physicians up to act more professionally, to attract revenue and really succeed. He was a finance professor in college, in a college. And his latest company effort is called RHM. And at LinkedIn, he describes it as a turnkey advisory platform and knowledge engine for healthcare professionals. He's like a lot of our guests, we become friends, and we have such cool friends. Mark, on his private time, is a charitable fellow, helping folks in underserved countries. His charity is called Hoops for Haiti. And as a former basketball player myself, I definitely want to hear about that. But as we kind of develop networks nationally for higher quality healthcare, whether it's discouraging bundled pricing, filtering out unneeded surgery, or even finding quality functional medicine, how do we build this network for integrated care? How do we get a filter in there to find quality? Because not all natural medicine is the same. How do we get folks, both patients and doctors, to expand their idea of what care is? How do we look at politics? There are government barriers to our innovations. Licensing, for example. As a lobbyist myself for a pretty eminent health freedom organization, we have a project to replace licensing with competitive certification. Will that facilitate the growth of this a more holistic, wide open health world? What do we do about sham peer review in hospitals holding maverick doctors back, or these insurance networks that threaten doctors that violate their very limited protocol? So a lot to discuss. Mark, why don't you take it away for however long you want to, 15 minutes, whatever, then we'll go to Q&A.
That sounds great. Thanks for inviting me. Thanks for having me. Looking forward to this event. I apologize right offhand. I had some flight changes. I'm actually in the Delta Lounge at the Cincinnati airport. So if you hear something, I'll try and mute it. But so far, so good. I want to start off by saying that it's the Victor Hugo quote: "Nothing is more powerful than an idea whose time has come." And I think that that's part of what's happening in medicine and health, is that there are ideas that are starting to take hold. They've taken root. They're taking hold. They're growing. And not from the perspective of the ideas. I truly believe that value comes in the execution of these ideas, but these ideas are actually coming forth as to where we are right now. So these ideas of simply how do we get a better system, right? You can't start with a whole system. I think that's part of the problem. A lot of people are trying to say, well, let's fix the system. Let's do this. Let's have disruption. And and disruption doesn't come necessarily by technology or patient engagement apps. That's not where real disruption in healthcare is going to come from. As Charles said, I was a professor, been an entrepreneur my whole life, worked with doctors. I always joke that I've been in the healthcare world, but not necessarily of the healthcare world, for about 22 years now. Worked with doctors on the business side, on the entrepreneurial side. And as with most entrepreneurs, something happened where my aunt got sick, was diagnosed with acute myeloid leukemia, and they basically said, go home and die. You've got 5 months to live. And some quote unquote crazy doctor said, hey, why don't you try stem cells? Went down the rabbit hole. She was treated and lived 5 years longer than anybody ever thought she would. Ended up being able to say goodbye and live the best life she could. But it sent me down a rabbit hole that not just from a regenerative perspective, but also from a care perspective. And having worked with doctors side by side on their business and understanding how difficult, how frustrated they were, to where we are today, to where half of all doctors are burned out. 9 out of 10 doctors say they are moderately to severely stressed. 2/3 of all doctors are actively looking for something else to do. And on top of that, 90% of nurses are actively looking for something to do. We're not going to get disruption until we understand what the root causes are. And that's one of the things that we've failed as a society in medicine and health is actually going after root causes and treating the root causes. We're treating symptoms. And unfortunately, we've been doing the same thing from a business and from an entrepreneurial and an economic perspective and a psychological perspective as well. And so there are actually 2 root causes. Please forgive me. I'm a teacher. I'm a professor. I love to teach. And so that's really what we're doing here. There's 2 root causes of all of health professionals' problems. I promise you, these are the 2 root causes. So if you want to figure out where to begin and how to move forward from here, there's only 2 root causes. One is improper mindsets, and 2 is not understanding incentives. The mindset simply of, oh, this is the way it's always been done. This is the way that I'm supposed to do it. This is the way I was taught in medical school, my residency. This is the way my physician group does it. Whatever. It's improper mindsets and being unable or unwilling to see beyond what it is that you currently know. And the second root cause of all health professionals' problems of not understanding incentives. See, people say that the medical system is broken or healthcare is broken. It depends on how you look at it. I think it's broken from a patient care standpoint. I think it's broken from a physician care standpoint, but it's working exactly how it was designed. And it's designed to keep physicians as rats on a wheel in a cage. Your objective, you are incentivized. We all make decisions. We can predict behavior based upon what incentives we put in front of people. We know that time and time and time again on study after study after study. And physicians and health professionals are incentivized by seeing as many people in a day as they possibly can. That's not real care. People talk about how, the patient-physician relationship doesn't, it's been taken away. Well, to a degree, it's been taken away. But the reason why it's taken away is because at the end of the day, we have to earn a living to take care of our family, go on vacation, buy the house, or pay the bills, or whatever it is that we want to do. We're all incentivized that way. And so at the end of the day, we have to figure out what our incentives are. And so if you want real disruption in healthcare, you have to change the incentives. That's starting to happen. It's starting to happen with a lot of people. And this idea of integrated care, this idea of integrated medicine and people working together and different physicians seeing that, as funny as it sounds, my mom taught me this song when I was young, and we laughed and we talked about it, is that, the hip bone's connected to the leg bone's connected to the knee bone. It's kind of a funny song from the, 50s or 60s. But at the end of the day, that's really what's happening. And people are starting to realize that we are more integrated beings than we really are. And that if you pull on one string, the rest of the web is gonna move, as Chief Seattle said. So if you want disruption, you've got to have a better understanding of what your incentives are, not just your incentives, but your patient's incentives as well. After that, I would say that that was really it right there. So to get into a little bit about our company, RHM, it stands for Regenerative Health Management. The regenerative aspect is a key. As Charlie said, it's a business system, advisory platform, and knowledge engine. Everything has to be done in such a way that it fits, it works together. We're working on a system of health managers, people who are more primary care driven, and we're partnering with specialists and working and building the system. We're working with folks like Charlie and Jim and Joe and a lot of other folks, because we need a system that's outside of the current system. And that system, what I believe needs to be, again, I'm a former economics professor and economist, that we need to find what I call horizontal integration, where everybody works together, everybody does what they do. The reality, though, is that the current system, the old system, is vertically integrated, soup to nuts. It's top down. If the CEO says it, then everybody has to do it, and we try to hide our mistakes. Whereas in a horizontally integrated system, we try to take advantage of the market's constant imperfections, and that's a good thing. So that's really what we're trying to accomplish, and why we're working with people like Charlie. We have RHM, if you want to take a look at it, it's RHM.care is the website. You can see about what we're doing there and how we're doing it. But we also have a heart for physicians and health professionals. And so we created an organization called Impact Health. It's impacthealth.care. And this is where we've got launching next month, starting October 1st. We're launching a new podcast where I interview, it's basically the New Health Economy Leaders podcast. So all of these really, as Charlie said, friends, and these amazing friends and people that I've gotten to know through the years that are leaders. They may not be leaders in the sense of not everybody's a leader as a scientist or as a senator or something like that, but they're doing something that needs to be brought to the forefront in this new health economy. You'll hear us talk about this new health economy, navigating the new health economy. This new health economy has been around for quite some time. It's just outside of what I call the old medical economy. The future is focusing on health. The past is focusing on medicine, because that's really what we need to do. So the other things with this impacthealth.care, most of this is completely free and available, or will be starting October 1st. You've got the podcast, New Health Economy Leaders podcast. I've written a book called Navigating the New Health Economy. We've got a free course that will launch. It's called Transition to Impact. It goes through 4 different lessons on how physicians can transition from the old medical economy into the new health economy and what it takes. And we also have, if you were to go to the page right now or go to the website right now, impacthealth.care, there's a free report that discusses the 7 emerging trends in the new health economy. These aren't necessarily treatments. We've got that too. We know what all the new treatments are and therapies are. But the emerging trends in the new health economy is about patient care and what is needed in order to truly provide patient care. And it speaks to some of those issues I was talking about earlier, the 2 root causes: improper mindsets and not understanding incentives. So again, that page or that website is almost completely free. There are things that you can get into later on if you were interested, but we've got books, videos, podcasts, courses, and now this free report. And it really, what we're looking at is what we're trying to help physicians make that transition from the old medical economy into what we're calling the new health economy. So Charlie, I don't know if you want to dig into with some questions there, but that was really my presentation and what I wanted to share with folks today.
That's excellent. So how can an integrated doctor contact you to kind of join this network building process? What is your vision on how that thing is going to grow and become influential for the new health economy?
Yeah, our vision is basically we need to, and this is going to sound funny, but we need to retrain and retool. You know, we've been talking about since the 1980s in America about retraining and retooling people and systems. That's really what we have to do. It's not that we have to retrain people on the care aspect or on the treatment aspects. Most physicians do a very good job of keeping up with that. What they haven't had a good opportunity to keep up with is the idea of actually building their own practice, building their own care, getting the time necessary to give what the patients want. You know, there's three main things that patients want, and I want to stay with this, and I'll answer your question further, Charlie. That there's three main things that patients want, and this is study after study after study, and this is not what they're given. The first thing that patients want is time and advice. They want time with their doc. Hey, doc, I want you to hear what's going on with me. And then the second part of that is I want you to give me real actionable advice. So listen to me and then tell me what I need to do. The second thing really comes down to what I'm calling DIY medicine and DIY care. What happened to plumbing and electricity and education in the early part of this century is starting to happen to medicine because people are not getting that time and advice. So they're going seeking their own care. So really what patients want, the second thing that patients want is they want to be active participants and partners in their own care. They don't want this idea of paternalistic, do as I say medicine is a thing of the past. That's not what patients want moving forward. And then the third thing that they want is they want real navigation. They want help navigating the complexities and the complications of medicine and health. So with that being said, that's where we need to retrain and retool. We need to teach people how to understand incentives. We need to teach people how to run a business. 80+% of all physicians are currently employed. The new health economy is about ownership. If you want to get into the new health economy, you're going to need to be an owner of your own business. That's really where the disruption and the change is going to take place. So we have a whole system and a whole network of training that we're developing, events, online courses, because that's what we need to do is we need to retrain people and get physicians back to where they were back in the day, and that's healers. And they're not healers right now. They're providers, and we have to re-educate from going from provider to physician again. So that's the big thing that we're doing in this whole impacthealth.care. What we're launching at the beginning of the year, the end of this year, beginning of next year, that's part of this, is we're developing what we're calling the Impact Health Academy, which is essentially, it'll be a full online university academy for physicians to learn how to do the business of medicine, the business of health, ownership, entrepreneurship. It will actually, there'll be different courses and pathways that folks can take where they're basically going to get a master's in entrepreneurship and business ownership as it relates to health. So that's how we're doing it, Charlie. Hopefully that answered your question.
Indeed, it kind of it's big. Do you need any help from innovative marketers like Joe Stoffacher?
Joe and I've had a couple of conversations, and Joe and I are very much in going to be having some very important conversations in the very near future.
Go ahead, Joe. Unmute yourself.
Yeah, I'm excited for that, Mark. One of the things that, we've talked a lot about that I love your perspective on that I think would be great for you to share with people is that the model that you're using really isn't new. It's the same model people have been using with their finances.
Yeah, absolutely. We're looking at this from the standpoint of, so we talk about medical advice and health management, very similar to the concept of financial advice and wealth management. And you can argue, there's the saying that you spend your health developing your wealth, and then when you're wealthy, you spend your wealth trying to save your health. And what we believe is those can actually be done at the same time. And so the idea that a integrative care physician, the idea that a primary care physician can actually take a look at the big picture, just like a wealth manager looks at the big picture and helps people with a plan and moving forward? That's a great question, Joe. Thank you for that. It's a unique approach to medicine and health that actually a lot of folks have been doing or been wanting to do. A lot of physicians have been wanting to do or trying to do. It just really goes back to that, really one of those two root causes, and that's not understanding incentives. You can't take the idea of so one of the things I talk about a lot is new wine in old wineskins. Sorry, I'm a professor. Hang in there with me. I know it always seems like I'm teaching, but that's really what we're doing here. It's really applicable to what we're talking about. So in Roman times, when people would take their Rome or take their wine different places, if they made new wine, they had to put it in a new wineskin. Because if they didn't, if they put it in an old wineskin, the old wineskin had dried out, it would crack, and they would lose the new wine. That's really what's happening. Is we're taking all of these new and innovative tools, regenerative therapies, biofeedback, new labs, all of these really cool things that are happening. But what's going on is we're trying to fit these new amazing things into these old wineskins, and that's the old system. So even those folks that come out, the DPC folks and the folks that try to go out on their own, they take these really new innovative ideas, even if it's patient care or regenerative therapies or whatever, and they try to fit it in the old model, the old medical system, because that's all they know. And that's what I think people like Charlie and myself and Jim, we're trying to create this whole new network where people can do really new and cool and innovative things, but get past the 20th century mindset. That's kind of what I'm saying about the improper mindsets. As the vast majority of folks in healthcare right now are stuck in a 20th century mindset, trying to treat 21st century issues. And it doesn't work. That's why we've got to get the new wine and new wineskins. That's why we need new and integrative systems.
And there's really 21st century technologies, right? So these health managers, provide, they listen, they hear what's going on, and then they can provide like a roadmap to say, hey, start here. This is going to teach you this next thing. Then you'll go here. Then you'll figure out a little bit more data. Then you can make this next decision. So they're really helping people, look at all of the information that people are finding on Google.
Yeah,
right?
yeah, it's fascinating. And that's part of it. So to speak to what you're saying, the first thing is absolutely, you've got to have a step, right? It's got to be a stepwise plan. In the big picture, it really comes down to this. You're looking at it from the first thing you have to do in the body is minimize inflammation. The second thing you got to do is manage manage hormones. If you do those two things, 80% of your issues go away. All right. And what I mean by that, and it speaks to what Charles said about the chronic diseases. There's plenty of data that shows that 80% of chronic conditions can be cured, not just made better. 80% of chronic conditions can be made better by behavior and managing behavior. Okay, why is that important, or why is health manager important? Same thing in the financial world. The vast majority of returns over time are because of the behavior of the investor, not because of they got in at the right time or they picked the right stock. It's about the behavior of the investor. That is the number one single most important key to long-term returns in investing in wealth management. It's almost ironically the same thing in health and health management is behavior and making sure that we're making good decisions moving forward. And so in order to do that, and this is what happened around the turn of the 20th century, when everything went from you had to pay $149 to get your broker to sell a stock, to where it went from $49 a trade all the way down to 7 cents a trade. I think it's probably in some places 2 cents a trade now. And people thought, oh, the financial world's going to go out of business. This is going to disrupt this. People are going to get all their information online. And yet one of the most respected careers and one of the most respected careers and one of the happiest careers, right? So one, the public respects, and two, the people in that are most satisfied with what they're doing is the financial advisors and the wealth managers in the world today. This is the same concept that we need to do and apply to medicine and integrative care. And providing that roadmap so people make good decisions and manage their behavior moving forward.
Hey, Mark, this is Scott Bethel. Can I ask a question?
Absolutely.
Sure. Hey, as it turns out, my mother is in the hospital even as we speak, and I'm in Chicago helping her out for a hernia, and the associated intestinal blockages and so forth that come with that. But your points have just been blasting me in the eyeball for the last 3 days of experience in the hospitals. And so, your point on education, everybody that we deal with, whether it's a nurse or a doctor, they sort of have this rote checklist. Okay, X symptom, Y treatment, which generally involves taking a pill or, that kind of thing. Or to get to this place, my mother went to several doctors who really couldn't diagnose her, and a hernia is not a particularly complicated diagnosis. But even leading up to this, some lifestyle changes, some other stuff may have been preventative, and the doctor that she went to failed to even see those consequences. So how can we help, or how can this group, or how can a group help increasingly, one, get medical community to understand that the insurance companies aren't the dominant decision maker in how people get to and receive treatment, because we've heard that a billion times. My mother's older, Medicare says blah, blah, blah. And I thought, well, that's just a freaking bureaucracy with a templated, symptom X equals treatment Y up to Z dollars. And two, how can we get doctors to understand that they're promoting and increasing their own self-interest and self circumstances is benefited by what you're bringing to the table? I know that was a long, but it's right been up in my face for the last 3 days, watching the people come in and out wearing big red hair and noses and big shoes. I mean, it just that seems to be the kind of personnel that we have encountered.
So I'm going to answer it first this way. Thanks, Scott, for the question. And it's something that I saw with family, I saw with personally, I saw, we've all seen this. And really what it comes down to is, I want to be clear here that it is not the fault of the physicians, but it is now their responsibility. And what I mean by that is simply, they are in a system that requires them to do certain things. If you want to get paid, you talk about your X plus Y equals Z, that is the treatment protocol, right? X plus Y equals Z, because that's what we're told that can be done. And, you can look at this from the perspective, and for those who don't know, I am as hardcore and ardent a libertarian as our friend Charles Frohman, but it's not from the standpoint of saying I'm a libertarian and Libertarian Party and everybody can go smoke dope. I don't care what people do. I'm looking at more from a little L libertarian, from the standpoint of people making personal decisions and dealing with the responsibilities of those decisions. And we have had that taken away from us completely in the way the current, what I like to say, the old medical system, or the matrix of modern medicine, has done for us. And so it is a incredibly complex problem that actually has a relatively easy solution. And that is stepping out and really ultimately physicians looking at it from the perspective of, if I want a relationship between the patient and me, if I want to hold the patient-physician relationship as sacrosanct, then I need to understand that I need to change the way that I'm incentivized. And the way I'm incentivized is not by, in the system, you're incentivized by seeing as many people in a day, and you have to change the incentives. And so part of that changing that incentives, and I said it's a relatively easy solution, but it's hard work. And that's why, Charles, you said earlier, is that how do we put this system together, and how do we communicate with everybody? How do we put it? You got to have a couple of people, at least a couple people, and then there's more and more that are somewhat crazy and willing to say, I'm going to keep fighting this and doing this. And that's ultimately what the folks on here and my business partners and I have done in creating the organizations that we've created, is that we needed to find a path forward. I'm not saying that what we're doing is the end all be all and it's the solution to everything. I'm saying it's a solution. The more choices that patients have, the better. The more choices that physicians have, the better. I tell you time and time again, I've talked to physicians for the last 20 years. And one of the things that I've heard consistently is that physicians feel trapped. They don't know where to go. They don't know what their options are. They don't. That's ultimately what we're trying to do. We're just, and some people laugh at me when I say this, but we're just beggars showing other beggars where the bread is, right? And that's what we as a society, as a group, as people on this webinar, people in our organization. Hey, we happen to know where some of the bread is. Here's a path forward. And so, Scott, I don't know if I fully answered your question, because I don't know if I fully can answer your question specifically as far as how it relates to your current situation. But at the end of the day, I think it comes down to is, and it sounds harsh, and it sounds like it's a harsh way of looking at it, but it's not the physician's fault, but it is now their responsibility if they truly want to move forward and participate and be a part of the new health economy.
That absolutely makes sense. And I realize that it's a difficult, you're bucking a multi-billion or trillion-dollar, I don't know, whatever the money we're talking about, enterprise. And there's a lot of Porsches and Lamborghini, whatever, fancy things parked in the parking lot at the hospital, and lifestyles that have to be maintained. And that's not a shot at doctors, but what you're suggesting.
It's the system. Yeah, it's the shot at the system. It's not the doctors themselves, it's the system.
Absolutely.
Right?
Absolutely. And it is, it's not, they have to have the desire and the incentive to modify those very rutted in, like symptom X equals medication Y should have outcome Z. If it doesn't work, then we try medication P and should have, and on through that templated escalatory cycle. But you're right, you got to find some early adopters that have enough prominence to grab other willing early adopters, and then the momentum can build and so forth. But there's a lot of people that make a lot of money through the existing system. And again, it is a system, but you're 100% right. Okay, they're in the system, but it's their responsibility, and their responsibility that they have to patients to give them the best. So copy.
Absolutely. And I want to toot our horn a little bit, if I can. And I don't mean it to say that we're the best or we're the end all be all, but we've been working on this system for 10 years. We've worked with a lot of physicians, a lot of scientists, a lot of psychologists. We've talked to a lot of people, a lot of entrepreneurs, and building the two systems that we have. RHM and Impact Health are two different systems. RHM is the actual system of business, and it's the business system, advisory platform, and knowledge engine, whereas Impact Health is more of a training and educational platform. But we've spent a lot of time developing this, and we really want to help a lot of people.
Mark, another way to grow this after finding early adopters is partnering with similar ventures that can repeat what you're doing with a sort of different market. And Dr. Willems has his hand up, if he could unmute. And I invited him to this show today because he's filtering out unneeded surgery. And for a lot of us to get this ideal system of integrated care, quality filters, and learning from our mistakes, especially, I love that comment from you with horizontal integration, not hiding mistakes, but learning from them. Dr. Willems, go ahead. Does that resonate with you, learning from mistakes to filter in better care decisions?
Absolutely. I mean, everything that you've said, Mark, is spot on. I use a little bit different terminology: incentives, artificial price fixing. So, medicine is the only profession that I'm aware of, other than politicians, where the worse you are, the more you make. And so the incentives are terrible. And then the other one is mandates by morons. And of course, that is the mindset. And I would just disagree a little bit with you, Scott, in that it is doctors' fault. The doctors they feel like they're stuck in this model, but they don't do anything to get out. And
I agree.
And if they would just realize, for example, a hospital is nothing more than a dirty, expensive hotel without doctors. And yet it's the tail wagging the dog. And so I get really frustrated with doctors who say, well, I can't do anything about it. Well, then you're a coward, because you're there to treat your patients and do what's best for them. We saw that terribly in this pandemic, where there's such easy things that can be done to treat. And yet they were afraid of what the board would say or what their peers would say or whatever, instead of using their brains. I started teaching in 2001, both nationally and internationally. So I can relate to the teaching aspect of going through this. But what's interesting is when you start and you get out of your bubble, you see the bell-shaped curve that applies to every profession, and doctors are not unique. Mm-hmm. And so the handful of truly phenomenal docs would quit in a heartbeat if they could. Why? Because there's no incentive to be brilliant or to come up with good ideas. You just get beaten down. So in 2013, I'm sure a lot of us on this call have read Atlas Shrugged. And so I built a company called ADX. We're rebranding it now, but it stands for Accurate Diagnosis. And it's a network of specialists. I'm an interventional pain medicine doc. I have neurosurgeons, orthopedic guys, regenerative medicine docs, everything I need to actually get patients better once they come with a musculoskeletal condition. And I give those docs an escape, but I'm looking for, so I created Galt's Gulch for the very best and brightest that are out there. We pay them what they're worth. And then to your point, Mark, as far as the horizontal integration, learning from experiences, we have no way of really looking and seeing, is my treatment better than my true peers? If I'm using regenerative medicine, is it PRP versus bone marrow versus allograft? Which one's better? No one knows. And so I had to build software that would integrate my network so that we could collegially compete and see outcomes per diagnosis. And there was no software out there that does that. Electronic medical records are just garbage in and garbage out. They're billing tools. They don't help me make a patient better. So I love everything that you're doing. My question for you though is, you're spot on. What you're doing will work. The question is, where do you get your client base? And so where you go is the self-insured, self-funded market. And we've done that successfully now, slower than I would like, but we're now expanding into several states. But it's getting over that mindset of the employer and understanding they don't have to be stuck in this corrupt insurance system that is not getting their employees better and costing them a fortune.
Yeah, I would agree with you that the self-funded, self-insured place is definitely a where you go to get these patients. I would also say that the vast majority of people that are stuck, and they truly are, and I'm talking individuals now and patients, not physicians, are willing to go beyond their deductible. In fact, a lot of people are getting real care, and not even going and seeing anybody that's in their hospital system. So what's happening is, and this is what I'm talking about when I started with, nothing can stop an idea whose time has come. We're at a point where both patients and health professionals are wanting the same thing. There's just a few of us out there that are have been crazy enough to be dealing with this for the last decade or so, and saying, here, try this and try this and try this. And I think that there's a lot of groups out there now that are saying, hey, we've got a path forward. And so I have to be careful. I'm not a physician per se. I play one on TV sometimes. I'm just joking. I apologize for that bad joke. But I've spent so much time. I've spent my entire adult career as a professor and as an advisor to physicians. And so this comes from a very knowledgeable place. And I'm telling you that it is that if the physicians will step up, and I'm not saying rise up and join a union. That is the worst thing that you can do right now. If a physician will step up and say, where are my people at? And when I'm saying all the people that are on this call and other folks who are saying, we're helping you, we'll give you a guide, we'll give you a path, we'll give you a partnership, whatever it is, there are a lot of groups out there that are saying, we'll help. And if once the physician starts stepping up and saying, okay, I'm going to do this with help, or on their own, you want to be a cowboy and go do it yourself, that's fine. But the patients will follow, because I'm telling you, patients want time and advice. They want to be participants, active participants in their care, and they want someone to help them navigate the complexities. And if you will step up and do those three things, it's almost like Field of Dreams. If you build it, they will come.
Brad, follow up here before you go, Joe. Do you see, Brad, Mark's network and teaching apparatus is sort of a complement to what you're doing in terms of our conversation with Dr. Benz, where you start off with the integrated primary, preventive work, some innovative treatments, and then you go up to the specialist filter that you're kind of navigating? Does that make sense, Brad?
Oh, it makes sense to me. You know, again, as a specialist, we talked about this. Your functional medicine doc, the patient's going to need them forever, because that's what's going to keep them out of my office.
Right.
But if they wind up in my office, I need the functional medicine doc to optimize their health so that my treatment outcomes are successful. You know, my job is to put me out of business every single day, because you shouldn't need me for a long period of time.
Right. So one of the things that we developed, and this is going to fit into what you just said, Doc, one of the things that we've developed is what we call the three levels of health management. All right. This is why our health professionals are health managers and kind of like the wealth managers, but there's three levels of health management. There's medicine, there's health, and there's wellness. And I know that everybody, this is going to, oh, well, this is an economist view of medicine and health. It is. It's from the outside, but I've got a lot of experience in observing this and dealing with it firsthand. You have medicine, which is allopathic. We have acute issues, we have injury issues, we've got disease issues that we've got to deal with right now or very quickly. Unfortunately, medicine has been treated as the most important part of the three levels of health management. Medicine, unfortunately to you doctors out there, I apologize if I'm offending you, but the reality of it is medicine is the least important part of the three levels of health management. The other two levels, health and wellness. Wellness, if you say that you're doing wellness, you're not doing wellness. You're helping patients do wellness. Only patients can choose to be well. Well is an individual choice, but they don't know where to go. They need help. So that's why a health manager can help with individual wellness to keep people, sorry, doc, I apologize for this if this offends you, but we want to keep people off your table. And if we can keep people off your table, now we're talking about real health and wellness. That's the reality of what people want. People don't like surgeries. They like when when you're available and you can do something if there's a big problem, but people don't want to be on a table. They don't want to be taking a bunch of drugs. People want to live life. That's how we as human beings and the human organism is. We want to choose life, but we all feel stuck or whatever. So there's three levels of health management, and that's what you need to look at.
I don't think Dr. Willems will take offense to that, right, Brad?
I was going to say that didn't affect me at all.
Good.
It's sort of like getting a flat tire. You start with buying a decent tire, a decent set of tires, and then wellness is rotating them and keeping them inflated and you know and so forth. And then the doctor is the tire store when the tires you haven't taken care of and didn't buy quality blow, and he rushes in and puts a new tire on, only because that's the last solution of resort. If you would have done the first two things, you would be talking to the tire store.
I would agree with that 99% to this degree. Unfortunately, as human beings, we don't have the same interchangeable parts that they do at the tire store. And so that's where the regenerative therapies come in. Again, it goes back to that. It was a great analogy, Scott. I love it. But it's the why do we spend our health developing our wealth to spend our wealth to try and keep our health? Why can't we do it at the same time, right? And that's the integrative care that Charlie likes to talk about.
Joe?
I'm going to go back to Dr. Brad's comments here about the hospital and get Mark's input on this, take on this as well. It's interesting how poorly the system and hospitals treat the employees, right? Like 12-hour shifts under fluorescent lights, you know, the stress that they build up on their own staff and employees. And therefore, like, I've always seen nurses as the greatest gateway of changing the system, because they're more frustrated with their own health than even the doctors are. So the first place of getting the system people to opt out of the existing system to a new system, I've always seen coming from the nurses. The nurses seem to be the ones who are seeking out more alternative care. The nurses seem to be the ones who actually have more involvement with their patients. So in terms of listening to the individual and the customer, like, nurses seem to know way more than what the doctor does about the individual. So I guess, like, as much as I like to rip on hospitals, I also just really feel for the nurses that are in the systems that have so much empathy for taking care of the patients.
Yeah, I agree. I couldn't agree more that it's a lot of times the nurses are very much involved in patient care a lot more than they're given credit for a lot of times. And by the way, just as a quick aside, if anybody is a nurse or knows a nurse that wants to get into individualized care, we can help them too. But yeah, there needs to be a platform that, really what it comes down to is, and this is going to sound conspiratorial, and it's not conspiratorial. I'm just looking at it from the perspective of the way things are. I like to talk to my kids a lot, and even physicians, where we want to look at things the way we want them to be, but we have to look at the way things are. And the way things are is that the system is designed not to promote health. The system is designed to get paid. It's that simple. Brad, you talked about the EMRs, EHRs. They are designed so people can get paid by insurance, not by the patient, but by insurance. And so I'm going a little bit away, Joe, but at the end of the day, we have to have new systems. Again, it goes back to my comment of new wineskins, the new wine and the new wineskins. The new wine it could be treatments, it could be therapies, it could be the integrative patient care, functional care, it could be the 3 levels of health management. These are all new ideas, and people are executing on these new ideas, but we have to give them new systems in order for these new ideas, these new treatments, these new therapies to work. And it really, what it comes down to is that we are killing the provider, nurse, doctor, whatever. We are killing the provider to try and save the patient. And pretty soon we're not going to have any more providers to take care of the patients. And we've got to get beyond that. Doctors, nurses, doesn't matter. We have to afford grace, but only for a little bit longer, and saying, hey, there's other opportunities out there. It's time for you to go and start pursue those other opportunities.
So folks, raise your hand for any final questions. I'll leave you with the last word before I do, Mark. In chat, I put the Forbes featured combo of sharing with health savings accounts, which I sell to groups and individuals. It makes you a cash patient. Joe in the chat earlier mentioned the money doubling medical benefit account for lower level out of pocket. You got to upgrade from insurance. They have networks. Doesn't matter how much you're paying for a Blue Cross plan. They're not going to include the centers of excellence. That's what a network is. Now we're trying to create with carrots, not sticks, unofficial networks through Healthcare Blue Book, through Prater, through all these cash shopping bundled specialist pricing, through ADX therapy to filter out the best surgeons. And hopefully, Mark's network of integrative physicians for primary care, because we like to get ahead of the curve. And people are not going to remain satisfied with pill pushers or with this top-down cartel. We have to open our mind, just like Mark said. No one likes the cartel. There's an article I'll post in social media about another poll, how dissatisfied folks are with healthcare. So you can't just accept the status quo and fight to protect it. So with that, Mark, give us your final takeaway, how folks can reach you.
Yeah, so the 2 companies that we're helping folks with is RHM, RHM.care. And RHM is where our health managers and medical advisors are helping patients navigate the complexities of medicine care. and then to help educate and provide resources to those physicians and nurses and health professionals that are looking to get out of the matrix of modern medicine, take that red pill and try to live the life that the best way they can. And that's Impact Health, impacthealth.care, helping physicians navigate the new health economy. And you can go to if you want to send me an email, ihc@impacthealth.care, ihc@impacthealth.care. We can start a dialogue, and if there's anything I can do to help people, but check out that free report on the impacthealth.care, 7 emerging trends in the new health economy. And that is going to get you to begin to think about how you can make the changes necessary to be successful in the new health economy and get away from this old medical economy. And pursue sharing. Sharing is the key to the future of what we're doing. The old insurance system is going to collapse. I know you think I'm crazy for that, but that's just, if you want to have that discussion, I can show you step by step on how it's happening, not just going to, but how it's happening. And moving forward, the way to really take care of your health is through a sharing company, and talk to Charlie about that because he's got all the answers on that.